welcome to today's prenatal workout for anyone who's experiencing lower back pain, pelvic pain, or SI joint pain throughout their pregnancies. If you're new to Element, welcome. My name is Jennifer. I'm a Pilates and yoga teacher, and I specialize in women's health. This workout today is a combination of both Pilates and yoga exercises. So I found that a combination of different poses and different positions from both methodologies really gives you the best chance to work through discomfort that you might be having in any of these areas. It's safe for all 3 trimesters of pregnancy, but as always, listen to your body. And if there's anything that we're doing that doesn't feel comfortable for you, please feel free to sit back and rest where you need. Now, if you have any questions about the workout, please feel free to pop it into the comments down below. And don't forget to like and subscribe to the channel. And that way you can keep up to date with all of the new videos and tutorials that get posted each week. It's also a really great way for me to connect with other women around the world and help them through their pregnancies too. So for today's workout, you'll need your mat, a small folded towel or a blanket, and 2 big cushions. Perhaps couch cushions or yoga bolsters will be perfect. All right, when you're ready, let's make our way to the mat. So we'll start off our workout today kneeling down on the mat. Now, if you're not comfortable kneeling, you have a few options here instead. As long as it's comfortable for you to cross your legs, you can sit like that and it's not pulling any tension onto your pelvis or lower back. You can also sit on a bolster or a cushion just to prop you up a little bit. Or if you just need a little bit more support, perhaps fold up a towel or a blanket, place it underneath your hips here, and that will just lift you up a little bit away from your heels. Now, if you've got your 2 big cushions or bolsters, just put them to the side for the moment. So we'll start off our warm-up just in the mat. Okay, so let's begin just by bringing the hands beside us. Lengthen up through the crown of the head and think about your posture. So we have a natural small curve through that low back. We're drawing the rib cage up and away from the pelvis. Give your shoulders a big roll up, back and down, just to release any tension around the neck, the upper back. Widen across the chest and reach the crown of the head higher up to the ceiling. Let's start here with a side bend stretch. As you inhale, stretch your right arm up to the ceiling. Exhale over and across to the side, reaching out through the fingertips, keeping those shoulders gently down away from your ears. Inhale, come back up to the top. And exhale to lower. Let's go for the other side. Inhale, reach. And exhale, side bend across. Reach out through the fingertips. Inhale, bring it back up and lower it down. We'll do 1 more on each side. Reach, inhale, exhale, and coming back up with control, lowering it down. Last one here. Inhale, reach it up. Over we go, stretch and across. That's it. Lift back up. And lower it down. Now bring both arms out in front of you. That's it. Again, think of lengthening up, tall, straight, neutral spine. This time we'll add a twist. Start with a breath in. On your exhale, bend your right arm, pull that elbow back behind you, and gently rotate your upper back. Now at the same time, reach your left fingertips forward, creating that diagonal pull between those arms. Next time you inhale, reach back through the front. And then exhale, let's change sides. Pull that left elbow back, reaching forward with the right arm, open across the chest. Use your inhale to come back through the middle. And let's keep going with those. So just rotating our upper and our middle back here. So try to keep the lower back and the pelvis nice and steady. Keep heavy on your sit bones. Good. So as we get bigger throughout our pregnancy in our belly, we tend to get tighter in the chest and the front of the shoulders, which is really common and really normal. But the problem that creates is it brings stiffness into our spine. Good. Now, if we can learn to mobilize our upper back, now middle back a little bit more, it takes pressure away from the lower spine. And that way we can free up a little bit more movement. Good. And allow less pressure around the hips, the pelvis, and the lower back. Last one here. Good. Even out on both sides. And then come back through center and release your arms down. Now bring your hands into your lower belly and let's now focus on our breathing. We'll start with a deep breath in through the nose And then exhale completely all the way out. When there's no more air left in the lungs, take a deep breath in again, all the way up. And all the way out. And just keep going with those. So I want you to take nice, deep, full breaths. Good. Thinking about as you breathe in, your belly and your chest expanding out nice and wide. And as you exhale, just feeling everything softening and drawing back in. That's it. Good. One more deep breath. Inhale. And exhale. Good. Now let's focus on connecting our core and our pelvic floor muscles. So these are going to be crucial for providing support for any tension you might be feeling around your pelvis or your lower back. So again, let's start with a breath in, nice tall spine. On your exhale, lift and engage your pelvic floor around the front and the back. Keep lifting and now engage your core muscles. Feel like you're pulling your baby upwards and into the spine. Everything is connected and supporting you. Now as you inhale, release that all the way down and let it go. Use again that exhale to connect. So use the pelvic floor muscles. Connect deeper into the core. Lift the baby. That's it. Draw the baby inwards to the spine. And release completely. Keep going with those. So we use our exhale to connect, engage and lift. And our inhale to gently soften and release it out. Good. One more like that. Lifting up through pelvic floor, engaging into the core muscles, and then releasing out completely. Good. So as we go through our workout today, I'll keep reminding you to engage your core muscles. And just a reminder as we move, if there is anything that you're not feeling comfortable doing, please step back and rest where you need to. Okay, so let's begin now in our 4-point kneeling exercise. So turning around, placing your hands flat down onto the mat. Your hands are directly beneath your shoulders and your knees are under your hips. You can keep that towel or blanket underneath your knees here if that's not comfortable. Let's think about pressing up and away from the floor. So really stabilize those shoulders, widen across that upper and middle back. Let's begin here with our cat stretch. Take a deep breath in to prepare. On your exhale, tuck your tailbone, round your spine, and draw the ribs up and in towards the back. So you're gonna let your head drop, look down at your legs, really stretching through the middle of your back. Now let's use our inhale to reverse. We roll through neutral. Now think of lifting up through the chest and the shoulders. You can lengthen your lower back, but focus more on the upper and the middle back. That's where we often feel tight into extension during the pregnancy. Again, use your exhale to round your spine, pressing away from the floor. And then inhale to reverse it out. Good, let's go for one more like this. Big round back position. Keep pressing up. Drawing the chin in, stretching the back of the neck as well. And then even out, gently extending the spine. And then return back into your neutral. Now, neutral position here, we check there's a straight line from the back of your hips through the shoulders up to the back of the head. Gently engage your core and pelvic floor muscles to stabilize you. Walk your hands forward about 1 or 2 hand spaces in front, keeping the hands about shoulder width. Maintain your neutral spine position. Let's start to now shift those hips forward, coming into like a plank prep, a half plank staying on your knees. As you inhale, lift the hips and press them back over the top of the knees. And then use your exhale to shift those hips forward again. Let's keep going with these. So what we're doing here is mobilizing through the hip joints, but we're making sure we keep our spine and our pelvis in that neutral alignment. And what this does is it teaches us to move out of the hips and rather than the lower back. We're using our core and our shoulders to support and stabilize us. That's it. Inhale, shift hips back. Exhale, shift hips forward. 2 more of those. Staying long through the back of the neck. Keep pushing away from the floor. Last one coming up. That's it. Now hold this one. So bring the hips forward. Being careful not to dip into any back extension. You want to maintain that straight line. Keep wrapping your abdominals around your waist. Lift the pelvic floor muscles up. And then release those hips back. Well done. Bring the hands directly back underneath your shoulders. Good. Now stay here and just draw some little circles around with the hips. Now that we've done our stability and our core strengthening work, we're adding just a gentle amount of mobility. Now our mobility work, we want to always use a bit of core control. So we avoid doing any big stretching or really deep stretching if you're experiencing lower back or pelvic pain during pregnancy. Good, and instead we want to just gently move the areas, but using the muscles to control it. Now let's reverse those circles. So drawing the hips around the opposite way. That's it. Just breathing naturally. Circling around. Let's go for 2 more of those. Hopefully freeing up a little bit of tension around that upper back, middle back, low back. Good, last one. Now come back and find your neutral. Let's lengthen up onto our knees now. Checking your knees are directly underneath your hips and your feet are back at parallel as well. Don't let the feet come together. That'll maintain good alignment of the hips and the pelvis. Now the tightness in your hip flexors here may make it difficult for you to come into a neutral spine. As you get bigger in your pregnancy, your hip flexors will get tighter and tighter to accommodate for that load in front. So do what you can. Bring your pelvis as far into a neutral position as you can, rather than letting the tailbone stick out behind you. Engage your glute muscles here, your bottom, just to help stabilize and hold that in place. Now from here, we're coming into a kneeling squat. As you inhale, reach your arms forward, lean out your hips behind you, set them back, but don't quite touch the heels. And then exhale, come all the way up. Find your tall neutral spine at the top. Inhale again, let's lean back, reach arms forward. Exhale, coming up. So we're gently working our leg muscles, our glutes, our hamstrings around at the back. That's it. Press those hips forward, stretching out through the front hips as you're coming to the top. Right, so as we move through those, hopefully you're starting to feel those quadricep muscles, the front of the thighs starting to engage. Let's go for 3 more. Inhale down. Exhale up. Just 2 more. Inhale. Exhale. Last one. Now let's hold it. So stay back with the hips. Now keep drawing your core muscles up and in. Lift through your pelvic floor. Keep stretching your arms forward. Let your hips lower down about 2 centimeters. Lift back up. Small lower and lift. So really working into those hips and thighs a little deeper here. Lift. We have 3 more. That's it. And 2. Good. 1 more. Come all the way back up to that tall alignment and then release your hands back to the mat. Well done. So let's return to our 4-point kneeling position here. Once again, reset back into a neutral spine. Engage your core muscles, engage your pelvic floor. Let's keep our back completely still and practice reaching our arms to the sides. Start with a breath in to prepare. Exhale, float one arm straight out beside you. Go lengthening out through the fingertips. Keep looking straight down at the mat. You want to keep your shoulders and your neck square. Now use your inhale to lower that hand gently back under the shoulder. On your exhale, take the opposite arm straight out to the side. And then inhale to lower it down. Let's keep going with these. So the challenge here is to keep even weight down through the knees. Stay long through that back. Good. Reach the crown of the head forwards, the tailbone reaching behind you. As you swap your hands, you should feel the connection change from one side of the core to the other. Good. Now what this is doing is stabilizing our spine using just the very gentle load of single arm in the upper body. One more here on each side. Good. Now, once you've evened out, return your hands back underneath your shoulders. Keep pressing up between the shoulder blades and then sit back on those heels. Reach your arms in front of you, drop your head down and stretch through the back of the neck. Good. And then gently roll yourself up to sitting. Good, well done. All right, take your time. We're going to make our way up to a standing position. We've been down on the mat for a while, so just watch your balance and watch any dizziness as you come up. So we'll start here with our feet about hip distance apart. Now, especially if you're experiencing SI joint or SPD pain, I want you to make sure that your feet are really aligned with those front hip bones. We avoid going too wide, which can place additional pressure onto the pelvis. So we're coming into our chair pose, okay? Let's start off in a nice, tall, neutral position. Have your arms relaxed down beside you to begin. Remember that gentle tuck under of the tailbone to avoid overly extending the lower back. Reach up through the crown of your head. Now from there, engage your core, your pelvic floor muscles. Use your inhale to sweep your arms up and overhead. Lean your hips back and bend your knees, sitting down into that chair position. So we make sure those knees are tracking forwards, aligning with our toes. They never roll inwards or outwards. Bring the weight into your heels. See if you can sit down just a little bit deeper into those hips and breathe. Inhale. Exhale, engaging the core. One more breath. Inhale. And then exhale, standing up and releasing. Let's do that once more. I'll turn to the side so you can see the position side on. Reach those arms up and overhead. Good, deep breath in. And sitting back down into your chair pose. Good, hips behind you. Long, straight line through the back. Engage the leg muscles, engage the glutes, engage core and pelvic floor. Stay here and breathe. Deep inhale. Full exhale. One more breath. And then release, come all the way up. Well done. Good, give those legs just a little shake out to release them. Now find your position at the wall. So I want you to place your hands just on the wall at about shoulder height. And you're standing a little bit further back than where your hips are, okay? Now from here, lean your hips back behind you and stretch out, opening through the back of the legs. Good, the back of the pelvis, right up through the spine, and then reaching out through the shoulders. So getting a lovely long release across the back of the body. That's it. Now here you can let your belly and your pelvis be really soft. Just take deep breaths. Don't worry about engaging too deeply into your core. Now as you inhale, gently release yourself back to standing. Now let's add a little bit of a deeper stretch. Walk your hands a little bit lower down along the wall. Press the hips back again. So here you may feel like you can go a little bit lower to the floor. Good. This is a great stretch to do at the end of the day if you're experiencing lower back pain, pelvic pain. That's it. Just keep pressing your hands into the wall. Drive down through the heels of the feet. Press your hips out behind you. Now, if it feels okay for your lower back, you can also add a little sway of the hips from side to side. Now, as you do this, I just want you to make sure, again, you've got that weight down evenly onto the feet, and it's not pulling any tension around the pelvis or the lower back. So just be really gentle, really soft with the movements. That's it. Last one here. And then come back through center, and then release all the way back up. Well done. So that was our stretch for the back of the body. Okay, let's do a stretch now for the front. Return yourself back to your mat. Come back down onto your knees. Again, knees should be hip distance apart. Take a seat back onto the heels. Now, your hands can slowly reach back behind you. Let your fingertips point in whichever direction they feel comfortable. So forward, out, back, whatever feels good for you. Now let's press up and open through the front of the chest first. Take a breath in and then use your exhale to lift your hips up off your heels. So you're stretching out across the front of the thighs, opening through the front hips. And then release those hips back down. Take a deep breath in. Exhale again, coming up. We'll do 2 more. Engage the glutes to really press the hips forward. Keep a gentle core connection. Lift the pelvic floor here as well. And lower down. You have 1 more. Press those hips up, opening through the chest. And then release to lower. Good, well done. All right, last exercise that we'll do. Find your 2 big cushions or bolsters. Place them here just at the end of the mat and make sure that they're really well stacked, one on top of the other. Good, so you've got a nice base of support among those 2 pillows. So let's turn around from here and I want you to just gently lean your shoulder blades against the back of the pillows or bolsters here. Now take your feet flat on the floor in front of you, about hip distance apart. Your legs are at parallel. Hands will rest just behind your head to give you some neck support. Now we must keep a neutral spine position here. At no point do I want you to use your core to pull your chest forwards, okay? Avoid doing any kind of crunch. You want to lengthen out through the crown of the head. From here we take a breath in. Now exhale, press through your heels. Lift your hips up and engage your glutes, making sure the knees are at parallel and hip distance. They haven't opened out to the side. Make sure the head is back in line with the spine, so we're not trying to pull the head or shoulders forward. As you inhale, come back down just before you touch the floor. Exhale, lift up again. And then inhale, lower it back down. Let's keep going with those. So this is such a good exercise, particularly for SI joint pain during pregnancy. Good, so we often perform this exercise just laying flat down on the mat. But the problem with that during pregnancy is that it then ends up, as you lift the hips, with an inversion. And especially in 2nd and 3rd trimesters, inversions can be really uncomfortable during pregnancy. They can cause dizziness and a bit of nausea. That's it. So being able to prop yourself up on 2 bolsters like this just allows us to move through the exercise safely, especially in our later trimesters. Let's do 3 more. So we should be starting to feel back of the legs. Good. Back of those hips engaging. Keep the knees in line with the pelvis. Last 2. Now 1 more. Let's come up and hold position. Exhale, lift the hips, open the chest back. Now really squeeze your glutes. Push through the heels of the feet. Keep your core muscles engaged. Lift through the pelvic floor. Let's hold this here for 3. Deep breaths. 2, 1, and then float those hips back down to the mat. Well done. Now to safely come out of it, grab your hands behind the back of the legs. Use your arms to pull you up to sitting. Amazing. Now let's come into a comfortable seated position. If you're okay to sit with legs crossed, feel free to end like this. But if you need to come back to a kneeling position to keep the knees closer to hip distance apart, that's fine too. Bring your hands just onto the knees in front of you. Lengthen up through the crown of your head. Let's practice our posture and our core connection 1 more time before we finish. Even weight on those sit bones, natural curve in the lower back. Remember, grow tall, draw the rib cage away from the hips, but avoid popping the chest out or rounding the shoulders forward. So everything is wide and supportive. Reaching the crown of the head to your ceiling. Now let's lift and engage the pelvic floor. Draw your core muscles up, in, that's it, lifting through the baby, and then releasing it all the way out. Good. Well done. Thank you so much for joining me today, and I hope to see you soon. I hope you enjoyed our class today. As I said before, if you have any questions, please feel free to place them down into the comments below. Now, if you're interested in learning a little bit more about prenatal health and exercise, or about myself or Element, you can head over to our website, elementpilatesyoga.com. There you'll find lots of great resources to help you through your pregnancy, and there are some full-length classes and programs for you to try as well. I hope to see you again soon.